Hi, everybody. I'm Lauren Byrne. I'm a postdoc fellow at the Huntington's Disease Centre at University College London.
Hello to everyone. I am Esther Cubo. I am a movement disorder neurologist working at the Hospital Universitario Burgos in Spain. Hello.
We're delighted to be introducing the first short communication session. This session will involve videos of around 6 minutes long, and then the speakers will be on afterwards to answer your questions. So please ask questions throughout the talk, and we will get them to the speakers immediately after their session. So don't wait to the end, please. First up, we have Filipa, Júlio. And she is a board member of the European Huntington's Disease Association and is the vice president of the Huntington Portuguese Association, and has been working on a project, or she's been the project manager for the Moving Forward project that the EHA have been running. And her talk is titled Research Participation, the View of Persons at Risk and Persons with Pre-Manifest Huntington's Disease.
I'm Filipa Júlio from the European Huntington Association, and I'm going to present our work about the view of people at risk and people with pre-manifest HD regarding research participation. So the starting point for our work was to realize that despite all the progresses in HD research, we still don't have any effective therapies that can either change or stop HD. And we believe that for these therapies to be true, HD families need to show an active and long-lasting commitment with studies and trials. More specifically, we believe those that are traditionally less involved in studies, such as people at risk or people with pre-manifest HD, should be engaged and heard in this process. So the main goal of this work was to understand which factors affect the willingness of people at risk and people with pre-manifest HD to participate in research and check for any differences between them. To do this, we have created a short online survey that was translated and made available in 12 languages, thanks to the help and solidarity of our members. This survey included questions about research experience and knowledge, sources of information, reasons for getting involved or not getting involved in research, and about the factors that can either prevent or facilitate study participation. And we then compared the answers of the two groups on these several questions. So the survey was filled by 525 people or persons from 27 countries that you can see here. And on this table, we see that persons with HD risk and persons with pre-HD were equally represented in this survey, which is quite nice, of course. So we had mainly women, young adults and people in their early 40s with a relatively high education level answering the survey. And interestingly, we found that persons with HD risk were younger than persons with pre-HD, although this matches the features that are usually reported for these groups. So these further answers show that most respondents never participated in HD studies, and around 40% of them thought that their research knowledge is not good or should be better. We found that people mainly rely on the internet to get research information, and that these groups, and this is a very important result from this study, turn to patient associations to get information, updates and news about research. So looking at the group differences, we see that the pre-HD group or persons with pre-HD reported more research experience and better research knowledge than persons with HD risk who rely more on their family members to get research information. So now speaking about the reasons for getting involved or not getting involved in research, and if we look at the brown bars here from left to right, we see that overall the reasons for getting involved in research were altruistic, so had to do with what this can bring to others, and were considered more important than the reasons for not getting involved in research. We see that people don't get involved in research mainly because of negative emotions such as anxiety or a sense of hopelessness about the future. And again, we found significant group differences. So we see that people with PhD, here in green, gave higher importance to the reasons for getting involved in research, and people with HD risk, that are here represented in blue, gave higher importance to the reasons for not getting involved in research. So about the two last questions, and looking at these two graphs, we see that globally the factors preventing research participation were tangible things such as time and financial problems or invasive procedures, and factors facilitating participation had to do with having easier access and more support from healthcare professionals. We also found that persons with HD risk identified more barriers to participate in research and the need for more support to engage in studies compared to people with PhD. So we can say that our multinational survey showed that persons at risk and persons with pre-manifest HD show high motivation to take part in studies, despite having limited research experience and limited research knowledge. So we found that this motivation is strongly influenced by both personal and interpersonal factors, such as time and financial constraints, the invasiveness of procedures, or the professional or family support provided. Importantly, and this is one of the major findings of our study, we found that this motivation to take part in studies is clearly influenced by HD status. So to conclude, we can say that based on these findings, we can have now a solid knowledge base to prepare the implementation of actions within Moving Forward, which is the latest EHA project that aims to increase the research engagement of these specific groups. Also, our findings suggest that patient associations have a key role in promoting research engagement through education and support. And this is quite important because it really validates our role in this process. And finally, our findings suggest that tailored interventions would be probably more effective to bring these groups closer to research. So this is what I wanted to say. Thank you for your interest in our work, which is also displayed in a poster at this meeting. And I will be happy to provide any further details if you want. So thank you.
Thank you, Filipa.
Yeah. Thank you, Filipa, for your very nice presentation. While we are waiting for the audience questions, I would like to ask you about the fact that after the COVID-19 pandemic, research was stopped in many centers, and that telemedicine took a place. Do you think by using telemedicine tools, research access can be improved, considering that this population is an age they work, it's a group work group. So do you think that can be increased?
For sure. One of the main results of our study was to see that the internet is the main source for these two specific groups to get information about HD. So probably it will be the same with care assistance and healthcare services. So I think it's the main tool for these younger generations, and it really should be used and in an effective way to provide the best assistance and the best care possible.
Right, by using virtual visits, yeah, teleconsenting.
Yes. And actually is a way also to reach groups that are far from the main hospitals or the main clinical centers. So I think it's a really resourceful tool, and it should be used for sure.
This is a great start to link us in with the last speaker about which is about a study for remote registry for juvenile onset Huntington. So it links so well. And I think one positive thing from COVID is that it's made people be more creative, and for something like Huntington's that is so rare and we really need to be as connected globally.
Yes.
One of the benefits is this rise in remote assessments and telecare in health.
And also, I think patient organizations can play a key role in this also, because they are clearly one of the favorite sources to get information. And so all the media and social media channels of the lay associations can also be used to reach out for these specific groups, I think.
But I think that the HD population is well considered because the research participation is incredible. Because in a small time frame, we can recruit a large sample. Your survey was answered by a huge sample size. It's incredible.
No, we were really overwhelmed with the number of participants, and we are quite happy with this work.
So if we don't have more questions from the audience, maybe we can move forward to the next presentation. The next